Hi, I'm Neil O'Grady, osteopath, and today I'd like to explain to you a manipulation called the shotgun technique for the pubic symphysis. So the pubic symphysis is here, it's at the front of your pelvis. So at the back you would have your sacroiliac joints on both sides, and in the front you'd have your pubic symphysis with a little bit of a disc in the front. Sometimes with pregnancy, or where you'll have an issue with an anterior or posteriorized innominate, you may have issues with this. So in order to locate the pubic symphysis, which is low, the easiest way to do it without getting yourself in trouble legally is just go to the navel, the belly button here like that, and with the heel of your hand, place it down here like that, and ask permission first. Is it okay if I just check your pubic symphysis here? Okay? So I'll press down like that, and it's very obvious because it's quite bony there. So from there then it's easy to find. You don't have to go anywhere where you shouldn't. You can just drop onto the pubic symphysis here, and you'll see sometimes it'll be very tender on one of the pubic tubercles, either left or right. You can get what's called a pubic shear, where one will be higher than the other, or one may be slightly posterior or anterior, or sometimes you can just get pubic compression of the pubic symphysis where the whole thing is just tender and sore to touch. And this technique tends to cavitate this joint and reset it, so it often resolves those issues. So how we would do it is this. So we'd bend patient's knees, hips to 45 degrees and knees to 90 degrees, feet close together like that. And what I'll initially do here is I'll use reciprocal inhibition here. So I'm going to get the patient to push out against my hands, which will activate the abductors on the hip. So I'm going to get her to push out against my hand. 5, 4, 3, 2, 1, relax, and push again. 5, 4, 3, 2, 1, relax, and push out once more. 4, 3, 2, 1, relax. Okay, so that will activate these muscles and they'll get a reflex relaxation of the adductors. So now I'm going to use post-isometric relaxation here, and I'm going to put my hands in here and I'll get her to push her knees together into the palm, the heel of my hand, which is less pokey and more comfortable. So push for 5, 4, 3, 2, 1 again. And most times this will simultaneously, it will just cavitate. So they'll either feel it pop or you'll hear sometimes a loud pop. So I go again. 1, 2, 3, 4, 5. So that hasn't happened yet. And push again, in, squeeze. Push, squeeze hard. There. And we got a pop there. So that cavitated the pubic symphysis. Sometimes it's just barely audible and sometimes it's quite a loud pop. So that is the shotgun technique. If you like it, please subscribe. Talk to you next time.